Hey everyone! Today I thought I'd discuss something slightly unconventional. So I've seen a lot of videos telling me how I can be a good doctor. So today I thought I'd make a video telling you how you can be a good patient. So let's say you get a particular diagnosis for a particular condition, whether it be eczema, whether it be allergies, whether it be IBS, whether it be a migraine, or some mood disorders or anxiety disorders. What is the first thing that I would ask you to do? Well, firstly, you need to take a breather. You need to calm down. What often happens when we get a diagnosis, especially from a doctor that we know, is that they expect treatment to start right away. They normally would advise you, okay, you know what, you need to get so-and-so surgery done, you need to go so-and-so test done, we immediately need to start off with this protocol. No, you don't. Most likely, if it's a chronic disease, and here I'm not talking about any emergencies, chronic diseases take years and years and years to develop. So taking an action in the next 10 minutes doesn't seem sensible. You can wait for that 1 week or 2 weeks. You can take a breather. You can understand what's happening to you. You can, in the meanwhile, even take a second or third opinion to confirm your diagnosis. And then when it comes to actioning on the diagnosis, you need to find the different streams that are available to help treat your condition. So don't be blindsided. There is no particular stream that is the best for everything. Every stream has their strong points and every stream of medicine has their weak points. So whether it be homeopathy, whether it be naturopathy, whether it be allopathy, whether it be aromatherapy or just counseling and psychiatric therapy, every stream of medicine has certain ailments that they can handle much better than their counterparts. So try to understand where your condition fits in. And then once you understand where your condition fits in, try to see which doctor resonates well with you. Some people prefer to have a doctor who's very, very busy, who has a huge practice. And some people prefer to go to a doctor who has more time available on their hands. They prefer that one-on-one interaction. They prefer the doctor sitting with them for those 15-20 minutes, half an hour and discussing their case and giving them advice. So try to see who resonates well with you. And then accordingly, once you pick a physician in that stream of medicine, try to understand from them about your condition. We all have Google and we all have Wikipedia and we all have WebMD at the tips of our fingers. But often what happens is that those websites tend to confuse lay people. Probably as a medical doctor, when I look at these websites, it gives me a little more clarity and understanding. But when you look at them, it can get a little confusing and more often than not, very intimidating. So you feel like you're much sicker than you already are. So don't do that. Let your doctor explain to you what exactly is happening to you. So let's say your diagnosis is eczema. Your doctor should sit down after the consultation and explain to you what causes eczema, what is eczema. Normally in their branch of medicine, what is the treatment pattern with eczema? So in homeopathy, at least when I see a patient, I always explain to them that with eczema, there are lots of up and downs. It's generally an allergy. We try to figure out where the allergy could be located. Then we try to understand the different symptoms and manifestations that this allergy is producing in this individual. Probably they also have allergic rhinitis with the eczema. Probably they also have asthma with the eczema. So kind of try to correlate all the different conditions that are happening to them. And then give them lots and lots of lifestyle changes. So when your doctor gives you these changes, a good patient is one who kind of tries to understand and integrate them. Just taking a medicine is very, very easy, but is generally not enough. So you always need to go that extra step. So when your doctor tells you to sleep better, or to eat better, or to consult a nutritionist, or to start doing some form of exercise, do it. Don't just follow one-sided treatment plans and then go back to your doctor after a month and tell them you're not feeling better. Because that's not what he advised. What he advised you was to do everything simultaneously. So let's say even with the example of eczema, I ask my patients to follow certain home remedies, I ask them to do certain applications, I give them internal treatment, I advise them lifestyle changes, and all of that needs to go hand in hand. So once you understand those aspects, follow them regularly. Don't follow them for a week, don't follow them for 10 days, follow them for as long as your physician asks you to follow them. And that's what will make you a good patient. And lastly, Don't go doctor shopping. I know a lot of patients who go to a doctor for a month or two for their 15-20-year-old chronic ailments and then don't feel better and they immediately want to swap, and then they'll give the other doctor 1 or 2 months and then they'll swap again and they'll keep doing that. And ultimately what happens is that years and years have passed by, they are not better because they haven't given any one doctor sufficient time to be able to help them. Because certain diseases do not get better in a month or two. If you have a chronic 15-20-year-old complaint, let's say of psoriasis, within 2 months no doctor in the world can heal it. You need many months and years for you to be able to cure an autoimmune disease like this. So once you understand what your disease is, how chronic it is, how intense it is, you have to give your doctor accordingly enough time to be able to help you. So don't go back in a month dejected. Try to understand that some things take time. For example, that's the example I give my patients, that pregnancy also takes 9 months. You can't hurry it up and do it in 15-20 days. So every physiological process has a particular number of days or months or weeks that it takes to regenerate. So you have to give your body that much time to heal. So go to your doctor with a follow-up. Give them the benefit of the doubt. Let's say you're better. Don't stop the treatment on your own and be some kind of self-healing treating physician. Let them tell you when to stop the treatment. And even if you're not better, go back to them and tell them that you're not feeling better and let them then assess how to treat you accordingly. So this would be my advice to you on how you could be a good patient. Hope you all liked it.